Dennis, thank you very much. Much more now on the coronavirus in Connecticut. A new study published in the journal Science suggests that COVID is here to stay, but in the long term, it could be more like the common cold. Joining me now to talk about that is Dr. Anyimadu, an infectious disease specialist with the Hospital of Central Connecticut. Doctor, thank you so much for being with us.
Thank you for having me, Erin.
So obviously COVID-19 right now is nothing like the common cold, but there is talk that eventually it could transition into something with similar symptoms. What are your thoughts on that?
So that is very true, and that's the hope that we all have. We are all hoping that someday it would become like the common cold. But the truth is, if we know anything about SARS-CoV-2, or this coronavirus, we know that it hasn't behaved in any way like the common cold coronaviruses, the 4 coronaviruses that cause common colds. So the truth is, if we are going to get to that level where it becomes like a common cold, we will need to have some form of herd immunity. Everyone would have to be exposed, and everyone would have to have some form of immunity, either through exposure or through infection or through the vaccine.
So if this does happen and there is herd immunity and a number of people, the majority of people maybe have the vaccine, does that mean people could potentially be diagnosed with COVID year after year, even if they have been vaccinated?
Oh, it's very possible. We don't know. The truth is, we are hoping that once everyone gets vaccinated, you'll produce some level of immunity, either antibodies or T cells that will prevent you from having severe disease from COVID-19. And at that level, if we have that kind of immunity, people can still have the virus in their nostrils, but they will not have severe disease, or they won't have severe infection from the virus. And we've seen that in the clinical trials for the vaccine. There were some people who still had the virus in their nose, but majority of them did not have severe disease. So we are hoping that once we get to that level of immunity, or that level of herd immunity, the virus will just be like a common cold. Some people will have it and be completely asymptomatic. Even at this point, we know that about 40% of people who get the virus will be completely asymptomatic. And that's the more reason why we all have to get a vaccine, and we have to get there. We have to mobilize people to get the vaccine so we can get to that level where everyone will be very comfortable.
Well, Dr. Anyimadu, thank you as always for your insight and expertise. We certainly appreciate it.
You're very welcome, Erin, anytime.
All right, always good to have him on. I don't know whether to panic, though, or be okay with this. Erin, thank you.